Thank you very much, Mr. Chairman. I want to read just a tiny portion of some of what I've received. Linda Mays, a registered nurse for 30 years who decided to retire this year at the age of 63, she says she was shocked at the prices she was quoted. The cheapest plan was $586.23 and covered nothing, with a $4,000 deductible and $6,350 out-of-pocket expenses and no medication coverage. She says, I'm still looking for the affordable part of health care. Les Gatto of Knoxville, and I don't know any of these people personally, sent me this email. Blue Cross Blue Shield of Tennessee up 62%. That's the percentage increase that Blue Cross Blue Shield requested in Tennessee. Blue Cross Blue Shield of Tennessee up 62% after going up 39% last year, and these plans pay for nothing, and he's got nothing in all capital letters. Where am I supposed to get another $6,000 next year, paid $10,000 this year for premiums, and 4 wellness exams, also paid at least $6,000 out of pocket for health care? Christopher D. Bush says average healthy 30-year-old male, and he said that his policy that he got 2 years ago, it's now going now 4 times the original cost of the premium. Blue Cross Blue Shield cites Obamacare as the cause for the increase. Ann Kovaleski, a 61-year-old from Knoxville, is paying $761 a month now, which was nearly a 63% over her prior premium the year before, and included a $3,000 in-network deductible, $6,000 out-of-network, and said this is quite expensive since she will have paid out more than $9,000 in premiums and $3,000 in deductible before their policy pays out a cent. Now she's been notified for the 62% Blue Cross Blue Shield increase. She said this would bring my monthly premium to $1,234 a month, $14,794 annually, this much out of pocket plus the $3,000 deductible. And she says the President promised on many occasions that the average family's health insurance premiums would be lowered by up to $2,500. And finally, Mr. William H. Power of Knoxville sent a message about his premium increases, and he says, in reality, I feel what we are experiencing is the sellout of the federal government to pass along the issues that we were told would not happen as a result of the ACA. My late mother was from Iowa. There was a public hearing out there where one individual testified that his policy would increase by $4,000 from $15,000 a year to $19,000 a year. That's what we're hearing from not only from all over my district, but all over Tennessee and all over the country. And I tell you, the people are really up in arms about this, and we're going to have to make some major changes. I went to a reception in the mid-1990s where the doctor who delivered me came and brought my records, and I asked him, I said, how much did you charge back then? He said he charged $60 for 9 months of care and the delivery if they could afford it. Medical care was cheap and affordable until the federal government messed it all up, and the few people who know how to manipulate the system have been getting filthy rich, and it makes no sense whatsoever because we've got more doctors, more nurses, more healthcare workers per person than any country in the world by far. And I really sometimes think that the people who foisted this so-called unaffordable care plan out on us knew that it wouldn't work, but that it would get so bad that people would then demand that we go to a single-payer plan, and then we'll end up with shortages, waiting periods, a lower quality of health care, and we'll have this Russian-Cuban type of medical system. I was on a congressional codel a few weeks ago, and the front page of the largest newspaper in Ireland had a front-page story while we were there and said they had 530,000 people on waiting lists in Ireland for medical care. You multiply that times 70 for the United States, you see where we're heading. Thank you, Mr. Chairman.
I thank the